Inflammation of adrenal glands, causes and treatment. The adrenal glands produce hormones that support a number of bodily functions. Inflammation of the adrenal glands may be a symptom of underlying conditions. This can include infections and conditions like cancer. Hormones produced by the adrenal glands help manage a person's metabolism and blood pressure. They also support the body's stress response. Certain conditions can have a negative effect on how the adrenal glands work. Some of these conditions can cause inflammation within the adrenal glands. For example, infections may affect the adrenal glands and cause swelling. Some forms of adrenal cancer can also lead to inflammation. This video examines what causes inflammation of the adrenal glands. It also discusses signs and symptoms of adrenal gland inflammation as well as the treatment process. What causes inflammation of the adrenal glands? There are several different conditions that can affect the adrenal glands and cause inflammation. Genetic mutations, infections, and some medications can cause issues with the adrenal glands. We discuss other conditions that can cause adrenal gland inflammation in more details. Adrenalitis. The term adrenalitis refers to an infection of the adrenal glands. There are many different infections that can affect these glands. In certain cases, these infections may cause adrenal gland inflammation. Infections that affect areas near the adrenal glands are one potential cause of inflammation. In a 2019 study, researchers examined a person who developed a urinary tract infection. This infection led to sepsis. After developing sepsis, the individual experienced adrenalitis and adrenal gland inflammation. Researchers believe that the urinary tract infection may have caused the inflammation of the adrenal glands. The adrenal glands are located near the kidneys, and a urinary tract infection can affect a person's kidneys. Xanthogranulomatous adrenalitis, or XGA, is a rare form of adrenalitis. This condition can also lead to inflammation of the adrenal glands. Adrenal gland cancer involves the growth of tumors within the adrenal glands. Although adrenal cancer can occur at any age, the average age of people with this type of cancer is 48. Research suggests that adrenal gland inflammation may be a sign of adrenal cancer. This may happen after immune cells travel to the adrenal glands to attack tumors. The collection of these cells within the adrenal glands may lead to inflammation. Other causes. Other types of infection may also lead to adrenal gland inflammation. In rare cases, tuberculosis can affect the adrenal glands. Research suggests that adrenal tuberculosis can lead to inflammation of the adrenal glands. A 2022 study also found adrenal gland inflammation in individuals with long COVID. Researchers believe that the coronavirus may travel through the adrenal glands. This can lead to inflammation as immune cells travel to the glands to fight the infection. Individuals with adrenal insufficiency may also develop adrenal gland inflammation. Adrenal insufficiency occurs when the adrenal glands do not produce enough hormones. Some people develop adrenal insufficiency because of an underlying autoimmune condition. Others may develop adrenal insufficiency if they suddenly stop taking corticosteroids after long-term use. Certain individuals with adrenal insufficiency may experience adrenal gland inflammation. Signs and symptoms of adrenal gland inflammation. The symptoms of adrenal gland inflammation depend on the underlying cause. One common cause is infection. Signs and symptoms of infection may include fever, chills, difficulty breathing, abdominal pain, cough, sore throat. In other cases, adrenal cancer can lead to adrenal gland inflammation. Symptoms of adrenal cancer can include weight gain, menstrual changes, blood pressure changes, weakness, muscle cramps. Individuals with adrenal insufficiency may also experience adrenal gland inflammation. Symptoms of adrenal insufficiency may include diarrhea, nausea, vomiting, joint pain, low blood pressure. Treatment for adrenal gland inflammation. The treatment for adrenal gland inflammation depends on the underlying condition. For example, treatment for infection typically involves antibiotics. Antibiotic medications can treat bacterial infections by destroying bacteria. Adrenal cancer is another underlying cause of adrenal gland inflammation. Common treatments for this cancer include surgery, chemotherapy, radiation. Adrenal insufficiency is another potential cause of adrenal gland inflammation. Treatments for adrenal insufficiency may include hormone therapy or, in rare cases, surgery. When to speak with a doctor. Anyone experiencing new or worsening adrenal symptoms should speak with a healthcare professional as soon as possible. An endocrinologist may also perform an evaluation or determine what is causing these symptoms. They can then recommend an individualized course of treatment. Adrenal gland inflammation may be a sign of different underlying conditions. This may include certain infections, adrenal cancer, or adrenal insufficiency. The symptoms of adrenal gland inflammation depend on the individual and their underlying condition. Visiting an endocrine specialist is an important step for determining what is causing the inflammation. An endocrinologist can diagnose and treat adrenal conditions. Anyone experiencing symptoms of an adrenal condition should visit a healthcare professional as soon as possible.